Hi, in this video, I'm going to talk about bipolar II disorder. This video kind of builds off of the previous video that was about major depressive disorder, so that's a good one to look at first. So bipolar disorder is, I would say, pretty misunderstood in general. I think a lot of people don't know truly what it is unless they or a loved one have experienced it. I think the term bipolar gets thrown around, if someone's a little moody or someone, is happy one minute and gets upset about something another minute, but that's really not what it is. It's a disorder that consists of long stretches of drastically different mood states. So it's not like happy one minute, sad one minute. It's sustained mood problems in chunks. So bipolar II disorder is, I would say, what comes up in our practice the most. Folks with bipolar II disorder are often highly functional, don't get hospitalized, they're out in the world able to do regular stuff. And I think a lot of people don't realize that that's definitely possible. So bipolar II disorder, by definition, involves depressive episodes, which again I talked about in the other video. So 2 or more weeks of the depressive symptoms at any point in their lives, so past or current. And it only had to have happened one time, although it usually happens much more often than that. So we've got those periods that are necessary for the diagnosis, and then we have something extra. So we've got the lows, and then we've got highs. And highs are not normal happiness. They're not like, I'm having a good day, I got a raise, I feel great, I'm gonna go out and celebrate. It's not that. It is way beyond that. It's like an offshoot, way above the, good day kind of feeling. So what this involves is a 4 or more day period of time where symptoms are present most of that time, that involve an elevation in mood. Some people describe this as high, euphoric, expansive, on top of the world, high without drugs, on cloud 9. So that is one of the main features. Either that or a high amount of irritability, like feeling very irritated easily about lots of different things, picking fights with people, kind of for no good reason. When we're in a bad mood, we can argue with people a bit more. But so it's either really high mood or really irritable mood for 4 days most of the time. Maybe not every single second, but it's kind of the underlying current of those 4 days. That in and of itself is not enough. Though one of those symptoms has to be present, and it has to be accompanied by several other symptoms simultaneously, which are feeling a very high level of self-esteem, like very confident, like going up to people, chit-chatting at the store, making jokes, like kind of feeling like you're, hot stuff. Decreased need for sleep. So this is different than being unable to sleep. This is, I don't feel like I need to sleep very much, or like, hey, I slept 3 hours, I'm perfectly fine now. And that goes on again for days in a row. Sometimes it's more minor than that. Like if someone's a usual 8-hour sleeper, they can be subtle and like they'll get like 6 hours of sleep for these days, but it's important to note that that feels like quite enough, and they still feel great, and they still have a lot of energy. Another symptom is talking a lot more than usual. So like talking someone's ear off, like not being able to stop, not being able to reel it in, pressure to keep talking. Sometimes this actually comes out as like very fast speech. Sometimes it's hard to understand people when they're talking this fast. The next thing is racing thoughts, and that a lot of people say they have racing thoughts in various contexts, but this is kind of like my thoughts are going so fast that I can't really even keep up with them. I don't even know. I can't complete one thought before another comes in. It's like going. This is also sometimes experienced by other people as something that's called flight of ideas. So if I'm hearing someone who's in a hypomanic state, they might be talking about one topic, then the other topic, then the other topic, and they're all kind of loosely associated, but maybe a little hard to follow, just like tons of ideas coming out really fast. Another symptom is distractibility. So like just kind of being all over the place, kind of being attracted to one thing, then the other thing, can't, complete one single thing, can't sit here for very long and finish a job. Another symptom is something called increase in goal-directed activity, which this can look like a lot of different things. Like sometimes it looks like reaching out to anyone and everyone in your contact list, like trying to reach out to friends, make a lot of plans. Sometimes people get very productive at work, like they'll take on more projects, get a ton of stuff done, stay late, just like work, and that's great to some degree, but it's in the context of some other problematic symptoms. Or this could also look like being more sexually active, like seeking out a lot of sexual partners, or even just having sex within your relationship very often. Or this can look like agitation. So increased goal-directed activity can be like taking on lots of projects, being very social, making lots of plans, a lot of sexual activity, or like being super restless and just like moving a lot. And then one other thing that often happens is involvement in activities that are unlike what the person would normally do. Like being very impulsive, making risky decisions. Sometimes that involves spending a lot of money without a lot of discretion, unsafe sex, silly investments, going off on a gambling spree. Sometimes this looks like, going out, being in like dangerous situations when you normally wouldn't, staying out, going out alone, things like that, things that can have bad consequences in your life. This period of time has to be different than someone's normal good mood. So when we talk about bipolar disorder, we've got 3 different mood states basically that we think about. We've got the lows or depressions. We've got what someone considers to be their baseline, which is called a euthymic mood. Not too low, not too high, kind of like within a normal-ish range, nothing extreme. And then we've got the departure from that in the other direction, which is highs or hypomanic symptoms. I'll end with this. This is called bipolar II disorder because of the nature of the highs. The highs are typically quite functional. Sometimes people really like them. Sometimes they help people get ahead in their careers, or be creative, or make lots of art, or be successful in some ways. But the trouble is here that I always tell people what goes up must come down. So when it comes to bipolar II disorder, you might have some periods of like super high functioning, feeling wonderful, but oftentimes that crashes, or eventually you're gonna, have a low. And so functioning is not even. It's not predictable. It's not a great way to have to live your life, to know like I'm gonna get everything done when I'm feeling in my high mood, So I can make up for, all the other times I'm in my low mood and I can't get stuff done. The other part of this, I will say, is that people spend the most time in a depressed state. So when someone comes into my office and tells me they have depressed mood, I always have to make sure that I also ask, have you ever had a period of several days in a row of feeling high, very energetic, wonderful, not needing much sleep, doing tons of activities, reaching out to all your friends, doing impulsive things, talking really fast, thinking really fast? I kind of describe it as like it's an Energizer bunny kind of thing for days, because this only has to happen one time. And a lot of people will not think much of it if it happened one time and they're mostly depressed. But the reason this is important is because the type of medication that's going to help people with bipolar disorder is not the type of medication that's going to help someone with major depressive disorder. So, whether the provider doesn't think to ask or the patient doesn't think to tell, it happens. It happens a lot. I think the average amount of time to proper diagnosis of bipolar disorder is 7 years. So a good thorough provider is gonna really drill about elevated mood. If there's any suspicion of that, we really dig into that, because that's very, very important to differentiate unipolar depression from bipolar depression. And bipolar II disorder is often missed because the highs are very functional. So I think that's all I'll say for now. I think the next video I'm going to explain a more drastic version of bipolar disorder called bipolar I disorder.